Now, there's also the critical part that I think is lacking in Ghana, and that is vaccine preventable diseases. There are vaccines for a whole lot of diseases. I'm sure you've heard about hepatitis and how it has become rampant in Ghana. But then let me tell you that there is a vaccine for hepatitis.
Welcome on and everyone, our lovely and cherished listener to Nana Kwesi TV. Education and entertainment hub, as you all already know. This is the program always I hosted for you entitled The Health Doctor's Joint. Here we bring you or talk more about the health, how you become more healthier. I will urge you to do only 5 things for me. Watch, subscribe, like, comment and share so that don't forget to press the notification bell so that you can get all our programs day and daytime. Today, I have in my midst a special guest, and today what we are about to discuss is very educative. As you already know, our slogan is educative and entertainment show. And before I will talk about what we are come to discuss, don't forget it's your host, Achim Kwanana. Stay tuned, I'll be back. Welcome once again to Nana Kwesi TV. Thanks for staying tuned with us. As I made it clear to you before I was going to break, I said I have in my midst a special guest by his name, Mr. Bismark Adams. He is a public health specialist with a decade. Yeah, you understand that with a decade. Yeah, he is a specialist when it comes to public health. So, with more time, we're about to discuss about the preventive health. Our topic is more, or we're about to discuss about the preventive health. So, I will just go and welcome our special guest. Mr. Adams, welcome to Nana Kwesi TV.
Thank you for having me, sir.
Oh, by the grace of God, you are doing good.
We are all doing well.
Okay, we thank God.
Thank you, sir.
We want to go straight to our topic for today.
Sure.
We are coming to discuss about the preventive health. So, we want to know about the preventive health. What is preventive health?
Thank you so much,
Okay.
Nana, for this opportunity to explain things and educate the public on some of these issues. I'm happy for us to have this conversation. But what is preventive health? Well, I'll briefly say that preventive health are measures that we take or put in place to prevent illness from occurring at the first place.
Wow.
So in Ghana,
Okay.
we mostly public health or health issues that we don't want to get sick at all. So the things that we do so that we don't get sick at all are preventive health.
Okay.
So it encompasses a whole lot of
Okay.
things, which I'm sure maybe in the course of our discussion
Okay.
we'll be able to
Yeah.
talk about it.
Okay.
But basically, preventive health are things that we are doing, or the health sector that make sure that we prevent as much as possible diseases from occurring. So we monitor, we report, and make sure that diseases don't spread, and also people don't get sick at all in communities.
Okay, thanks
Yes.
for that.
Yes.
And what do you say about preventive health in Ghana here?
Well, in Ghana, I would say we are doing well when it comes to preventive health. But there is more to be done, I must say. There is more to be done because when you look at our education on preventive health, it's on the low side. When you talk about maybe vaccination and those things, which is part of preventive health, maybe we'll delve into it in the course of our conversation. That one, in the children aspect, it's booming. The public health side, it's booming. It's becoming well known. People are now accepting it more than before. But when you talk of, the adult preventive measures, like, good nutrition, exercise, taking preventive health care, like preventive vaccine preventable diseases. I'm sure that there is more for us to do in Ghana. And the more we talk about these things, the more people come to understand and make sure that they prevent diseases and stay healthy.
Okay. We want to know more about the preventive health measures.
Thank you. So, just like I've mentioned already, preventive health measures encompasses a whole lot.
Okay.
First, I would say good nutrition is important.
Okay.
You need to make sure you are eating well. Sometimes when you say you are eating well, what do we mean? Is it expensive? Is it something that we can do?
I was about to ask that question.
But no, it's not that expensive.
Okay.
Once you want to eat health, it means you're cutting down your sugars, your salt, you're eating more fruit, you end up adding vegetables. These are some of the things that you do. So yes,
Wow.
it's not that expensive. It's not like go and get a meat or
So
something.
one thing about eating more meat or those stuff.
Yes, sometimes we feel like the rich people are the ones that eat more meat and enjoy this fatty food and fast food. No, we talk about good nutrition. We're talking about adequate vegetables, adequate fruits, and then mixing it with, our local food. And these are some of the things. Now, what aspect of preventive health again can I talk about? Good exercise.
Wow.
What do we see gyms, we see this.
Okay.
We can take a walk. Some of these things, it helps to burn down the calories that we have taken, because we eat a lot of carbohydrates. Our banku, our fufu, all of them are starch foods, and they build up our carbohydrates, and then they convert into sugars, and they tend to help disturb us. When you look at our data on mobilities or cases that we report at the hospital more, diabetes is now on the high, and diabetes is just sugar that is building up in your system too much. So if you cut down on your carbohydrates and then you exercise more, exercise, sometimes you don't even know what is your exercise routine.
Okay.
Taking a walk is a form of exercise. Cycling is a form of exercise. Running, jogging. Some people will go for the jogging and then come and drink the beers. Well, once in a while you can take a beer. I'm not saying don't take a beer, but once you go for a jogging, it's better you allow the system to run well without going to.
About you being saying walking, but we don't take more serious on that.
Yes, that is the critical issues. People feel like they need to put on some dress code and then get to the field or jog to a place before they will know that they're exercising. But taking a regular walk is so important, where you know that, oh, this one I'm not in a hurry to do something. You take a walk is better than always driving or something. You need to cycling is important. All these things is just to build your system to stay active. Once you stay active, it's going to reduce your stress. All the carbohydrates that are building up in you and cause transforming into sugars are going to burn down. And then once they burn down, you get your good health. Now, I've spoken about good nutrition. I've also talked about exercise in preventive care. Now, there's also the critical part that I think is lacking in Ghana, and that is vaccine preventable diseases. They are vaccines for a whole lot of diseases. I'm sure you've heard about hepatitis and how it has become rampant in Ghana. But then let me tell you that there is a vaccine for hepatitis. So yes, but because we don't know, mostly we are caught up in the net, and then we contract all these infections, which a short of vaccine could have prevented all this from happening. So when you talk of preventive health, we're talking about the good nutrition that I've spoken about. We have also talked about the regular exercise, and then most importantly, the vaccine preventable diseases that we can use vaccines to prevent a whole lot of diseases.
Then let's talk more about the vaccine preventable disease. We want to know.
You want to know? Okay. So what? Well, when you talk of vaccine preventable diseases, I'm sure you've heard about measles before. I'll use these ones as an example because they are common. First, you used to hear measles killing a whole lot of people. Recent data have shown that we have half the number of deaths of infants from 2019 to date by half, from like 50 million to like 5 million people in this period. And the key thing to this success in public health is through the vaccine preventable diseases and the vaccination that we have taken serious when it comes to our children. So you don't hear from measles killing people anymore. You don't hear pneumonia killing people anymore. You don't hear diarrhea killing people anymore. Influenza killing people anymore. A whole range of them. Yellow fever, meningitis. These are all vaccine preventable diseases in children that we have been able to use vaccines to prevent it, and then we have been able to reduce the death of infants by this number. Now, is there an opportunity for adults too? Yes. When you talk of vaccines that are available for adults, the children have hepatitis. The adults will have hepatitis.
Yeah. It's true.
And you know these days how hepatitis has become common in our hospitals.
Sure.
So when you go to any health provider and you say you want hepatitis shot, they will do the test quickly and then give you the shot. This shot is going to help you prevent you from contracting the hepatitis if your partner or somebody else has it. And which I will encourage everyone listening to us or watching us to make it a point to visit their healthcare provider and go get the shot of the hepatitis injection and follow the series of the hepatitis injection.
So can we get all this at the health centers
Yes,
across?
yes, across Ghana you can get this in
Wow.
all health facilities. Well, my company that I work with as a volunteer, Afrijanga, we go around, we screen people, and then we give them these vaccines,
Okay.
sometimes for free. But once you walk to any hospital, once you walk to any health facility, you talk to a healthcare provider that you want to get the vaccine for hepatitis, they're going to give you. Another key one that I have to talk about is the HPV vaccine. What does the HPV stand for? The human papilloma virus. This human papilloma virus is the one that causes a trace of the variant of it causes the cervical cancer.
Okay.
If you have heard of cervical cancer,
Yeah.
these days it's becoming more and more. The data we're seeing is alarming. A lot of people are getting the cervical cancer, and this is not it's something that we can prevent.
Wow.
So why do we people die
By
of
vaccines.
yeah, by vaccines, and the vaccine's name is what I've mentioned.
Okay.
The gather cells and those ones, we just named them HPV vaccine. They are going to prevent you from getting this cervical cancer and even genital warts. You've heard of genital warts
Yeah.
before, and it's common. It's very infectious, but you can use vaccines to prevent all these conditions that I'm talking about.
Okay. Is it that expensive at the health centers?
I'm not sure it's expensive.
Yeah,
Let me see. Yeah, but I'm not. You know, they say your health is your wealth.
Yeah.
You know, sometimes if you want to pay a little, to uh, uh, take care of your health, I'm sure it's good. Your health is your wealth. Once you don't have good health, I'm telling you, my brother, there's no way you can enjoy anything in this world. So it's better you go to them. Some of them, I'm sure once you have insurance, it can even cover it. But with the Gardasil or the HPV vaccine, that I think every woman from the age up to 45 years must go to the clinic. Those that are adults, they will take a pap smear test, and then if it's negative, they can give them the shot. Those that are from 9 years to like 12 years or 14 years who have not had any sexual encounter before, they can just go straight to any health facility. Adolescent, if it's a boy or a girl, they can all go to any health facility to get the Gardasil or the HPV vaccine. And for adult women who are not up to 45 years, they will have to do the pap smear test. Once they do the pap smear test, they will, if it comes negative, they will take the vaccine to prevent these diseases. And I will encourage all our women to take it up to do it.
Okay. Hold on for me.
Yes, sir.
I will get back to you.
Yes, sir.
So as you have heard, we are discussing about the preventive health. So by now, hope you have. Don't just watch or listen. Make sure to get an impact, a good impact on you. Stay tuned. I'll be back. Thanks for staying tuned with us or staying still with us. So, Nana Kwesi TV Education and Entertainment app. Subscribe, like, share, and leave your comment at the appropriate time. We read all your comments for you. As you already know, we are discussing about the preventive health measures. We're just talking about the preventive disease and also some of the vaccine preventable diseases. Yeah, we are just discussing. So we are moving to the side effects of taking these vaccines. So I'd like you to talk more about, does it have side effects?
Well, let me say, there is no side effect that is recorded, but it's a vaccine.
Okay.
It has gone through trials upon trials. All the vaccines that we have here, they have gone through trials upon trials before we give. But let me say that everybody and how their body system reacts. Somebody can even take paracetamol and react to it.
Yeah.
Somebody can take, chloroquine was having a lot of side effects on people. But some people also were taking it and they were having no issues.
Okay.
So it got to a point we realized that we need to withdraw chloroquine for the treatment of malaria.
Yeah.
All right. Now, when it comes to vaccines, once you take vaccine and you have any sort of, effect,
Okay.
quickly report it.
Wow.
Once you report it, investigation will be started. You go through the treatment. If it is indeed established that it was the vaccine that has caused that side effect, you will be known. If it
Okay.
was not the vaccine and it was, a mere coincidence, and sometimes some people they were having their own malaria,
Okay.
and they took the vaccine and then it came. You remember when the COVID came?
Yeah.
Some people say they had this, but we all survived.
Yeah.
And people even said that the COVID was here to, cause a whole lot of things. The conspiracy
Yeah,
theories
yeah,
when it
yeah.
comes to vaccines and the ones that are coming up. A lot of people. I have always talked about vaccination. I've always talked about, preventive care, and I've encouraged people. I've done this a whole lot of times, encouraging people to take preventive health serious. And once you do that and you're able to use vaccines to prevent all these diseases, you won't even force it to go to the hospital. And you know how it is to go through the pain and the money that you have to spend when you are sick. And if you have these critical conditions that vaccines can prevent, I think we have to take the chance.
Wow.
It's not necessarily think about the side effect. Go get it. Once you have any form of a side effect, report it. But I won't say there is any form of a side effect that has
on
been
the individual.
Yes, individual. Mostly it depends on individual. But there's no, registered side effect that when you take you're going to get this or that. No.
Okay. Okay. I asked this because when the corona or COVID-19 vaccines came, there was a lot people saying something. If you take in, you will get this, and it's a lot.
Yeah, some people said it was to, makes us change our sexual orientation.
Okay. So there was a saying
Yeah.
I've even heard
Yeah.
that some of the vaccines that came here or into our country are to change our sexual orientation. Is it true?
No. Let me be emphatic and say it's a big no. Okay? No. Vaccines don't change your sexual orientation. It's not only you. I must admit that it's not only you that I've heard this from.
Okay.
That these vaccines change our sexual orientation, or it will do this to make you gay, or no. There's no truth in that. There are people who have different sexual orientation, and that is fine. Okay, that is fine. But for you to take a vaccine for it to change your sexual orientation, that is a complete fallacy. There is no truth in it. There's no any established truth in it, and we have to do away with some of these issues.
Okay.
Yes.
Okay. So let me ask this: do we need a law to protect homosexuality? Because there was a just law passing by our parliamentarians.
Yeah, where you are taking me to, I will hesitate to comment, but then I'll have to make some few comments.
Okay.
I am a public health person, and there's a public health bit
Okay.
of the bill that they are proposing, or the one that they've passed.
Okay.
And I think that as a public health person, I might have a say on it. And my personal view and what I've propagated, that we don't need laws to, incriminate people who are homosexuals.
Wow.
I don't think so. Well, the proponents of the bill stated that in their bill that we would need laws because it's a public health threat.
Yeah.
Homosexuality is a public health threat. And then they cited an example of, HIV being more in homosexuals.
Yes.
Well, even though I can't dispute that data, and I can also confirm that data because I am not aware of any sort of data like that, that the HIV is more in homosexuals. I can only say, right, that even if that is true, which I am not confirming, but even if that is true, I don't think we need laws to ban them and then incriminate people. And then the bill also go ahead to do a whole lot of things. It goes ahead to make people that talks about it, like me talking about it, that it's not good. The bill incriminates me. The bill is, yes, you're going to send me to, yes, all people who advocate for the LGBT community are going to be incriminated. they're going to go to jail because they're talking about these things. But all of these things in a bill, I think it's a hate bill. It's not something that we should entertain. Now, let me make a clear example
Okay.
here. If you tell me as a public health person that, well, you have more condition of or HIV among homosexuals,
Okay.
and for that matter, you need a law to ban it.
Yeah.
I'll give you an example.
Okay.
If you go to all our mental health, hospitals,
Yeah.
right, and then you look at the women that are there with mental health issues, all the women of who are in sexual age and they are in mental health hospitals. If you ask them, I'm telling you that about 80% of them are there because of heterosexual relationship.
Mhm.
Yes, because they had a boyfriend, they had a husband
Wow.
who did this, who, they couldn't control themselves, and they end up getting mental health issues. Now, my question is, if those people who are there with mental health issues
Okay.
are a problem, just like maybe HIV is a problem in homosexual, do you tell me that because those people who are going through all these mental health big issues that we can't do anything about it? We need laws to prevent or to ban or to incriminate heterosexual relationship.
Mm.
Now I'm asking, there's
Okay.
you see
Okay.
the coordination I'm trying to draw.
Yeah.
There's heterosexual relationship.
Yeah.
There are problems with it.
Okay.
So if there are homosexual relationship and there are problems, you don't need to go and incriminate people.
So are you trying to say even that hatred is more faster than
No.
homosexual?
Yeah, what I'm saying is that in heterosexual relationship, people who go through heterosexual relationships are ending up in mental health hospitals.
Okay.
The evidence are clear that people who are in mental health hospitals, most of them are there because of heterosexual relationship.
Okay.
When you take men and women who are ending up in our mental health facilities,
Okay.
it's because of heterosexual relationship.
Wow.
And I'm telling you that we do not need law to ban and incriminate heterosexual people. Therefore, we don't need law to incriminate and ban homosexuality.
Wow.
Because it all comes in this life, even if you drink water, you are taking a risk.
Okay.
So what I think, and then the other aspect is, people trying to educate our children in schools, and I believe at some point we need some form of education
Yeah.
on even the LGBT community. We need to educate our children.
So can you say we lack education?
Yeah, of course, because if we are preventing people from speaking about it, now look at the law that they were passing and the bill that they were trying to pass. Look at the amount of information and the curiosity that it has caused in our children. They don't understand it.
Wow.
What is going on? And then you are telling me that we shouldn't talk about it. We shouldn't explain these things to our children. I don't think that is fair. We need to explain this so you don't incriminate somebody who is trying to explain some of these things to the
So
children.
we should teach our children about this homosexuality.
Yes, I believe. Because you don't need to live in a world where it's a small world. Now, a child can pick the internet, and he's here, but he's living in America, where homosexual is free. They are allowed to practice. And if you allow your child here and now teaching him how these things are, and for them to understand it, I don't think if you teach somebody about homosexuality, they are going to turn up homosexual. No. I believe even if you take the LGBT community
Okay.
and homosexual, there are people in it who can be pedophiles,
Okay.
who are interested in, children.
Wow.
If I am a gay person, I'm using this as an example,
yeah.
And I am making an advances on a boy,
Okay.
right,
Yeah.
who is just a minor, and that boy doesn't have any idea that a man can also be making sexual advances on him, he is likely to fall victim to the things that I'm going to do,
Wow.
as the pedophile is going to do. You understand?
Yeah.
So that is why you need to give the boy or the girl an education on these
Education is very,
issues.
very important.
It's important.
Okay.
So you don't make law that will incriminate people or ban people from talking about some of these issues. No. The world is moving at a very fast rate.
Okay.
You cannot be in your own corner and do things the way you do it. If you make laws here to ban them, they are going to get it, boom, it's about it on the internet. And that is a big deal if you don't get to, explain things well to people. So one, the issue of, homosexuality having more, or the LGBT community having more HIV infection, and that we need law to ban it. I dispute it. I don't think it's the best way to go. And
Okay.
then also not talking about it or explaining to our kids, I also think is not the best thing
Okay.
to do.
Okay.
This is what I have to say on it. I think it's not necessarily what we're talking about, but I have always talked about
Okay.
how these things, I mean, we should be careful.
Okay.
And knowing the president and as a human rights lawyer,
Okay.
and I mean a constitutional lawyer and a human rights activist, I must say,
Okay.
I don't think he's going to put his pen on that sort of bill. No,
Okay.
it needs a lot of changes.
Okay.
And the whole thing is that in this country, once you speak like this, I mean, the silent majority, they are cool. They won't talk.
Yeah.
There are other people too who are there, and then once you speak like this, they're going to, I mean, just tag you, agree with this. And then they don't even get to understand
Yeah.
what you
Okay.
are trying to push across.
Okay.
And that is why we have an issue here.
Okay.
I believe we need to, as a country, we need to sit back, analyze the issues, not to rush into all the things that we are going through now,
Okay.
and make sure that we're coming up with, I mean, values and other things, teaching or all that to educate our kids, to educate ourselves on what is going on in the world.
Okay.
And I believe once we do that, we will have a better sexual and family values, whatever bill or law that they want to put it up.
Okay.
Yeah.
So, lastly, what do you think about the bill in your last word?
I really didn't want to talk about the bill, but once you have taken me there, I think I've spoken,
Yeah.
I mean, a bit of it about it. That is naturally not what I want to go to.
Okay.
It's a very controversial thing.
Okay.
People are just not ready to understand and live and let others to live. It's more like they are, uh, they are, we are living in a world where the majority says, because there are a lot of Christians and Muslims. Oh, the Muslims are against it, the Christians are against it. What about the minor people? That is
Okay.
always what I consider the minor. Not everybody is a Christian. Not everybody is a Muslim.
Muslim.
And not even if the president is traditional, not everybody is even a traditional. Some people don't even believe.
Yeah.
And this country is not governed by, I mean, Muslim laws or Christian laws.
Yeah.
So
It's
you
true.
cannot, I mean, I think you cannot come up with bills that are, I mean, Christian in nature or Muslim in because we are the majority. Now, if we do that, we are silencing some part of our society. I believe we need to bring everybody on board. Everybody has something to contribute, and it's not necessarily somebody is gay or somebody's sexual orientation. We should incriminate them. I think that is wrong. And when you look at the proponents of this bill, some of them have made comments that if you're not political, I mean, experience, they wouldn't be doing what, or they wouldn't be forcing this bill as they're doing. Because we know some of them who have made comments on the bill,
Okay.
or some of these things, homosexual issues, previously.
Wow.
You understand?
Yeah.
They've made comments that they've said that bread and butter issues are our problems, not what, I mean, those days, not what who President Mahama spends time with.
Okay.
I mean, he has gay friends.
Yeah.
He was spending time. I don't have a problem, but these same people are now the ones pushing for this bill. And I believe the president will be circumspect. I mean, he's a constitutional, like, who am I? And he will be able to understand well, know what he has to do, not fall for the pressures or the political pressures to do things that is going to, I mean, in the long run, affect some part of our society. Nobody is bringing gay here. We have had gays here for a long time.
Okay.
We have had lesbians here in this country for a long time. The only thing is that we have not given them a voice.
Okay.
And the only thing now is that we are trying to send them to jail. And I think that is wrong. All right.
Okay. I will thank you for having you here
Yes.
and for this discussion. So, you have some people you want to greet?
Oh, yes. I think if you look at my shirt that I'm wearing, you will see Afrijanga in it. This company has been my backbone, supporting my projects that I've been doing in communities, in churches, in schools.
Okay.
So I must say thank you to them. You see them
Yeah,
here,
Afrijanga.
Yes.
Okay.
So I want to say thank you to them
Okay.
for their support
Okay.
in everything that we have been doing, trying to educate the general public on. We go around communities, we organize health, I mean, screenings to identify diseases, preventable diseases and other, I mean, lifestyle diseases like hypertension, diabetes, and all that. We also go to churches, we go to schools to educate And this is what we've been doing by the support of Afrijanga. And we are saying good thank you to them.
Okay.
Now, thank you to everybody too.
Okay. Thank you too.
Yes, sir.
Okay. You heard Mr. Bismark Adams. He is a public health specialist with decade. Yeah, with decade. And you heard me too. Your host, your able host. Atemukwana na binumbre modisheba kwaku pain. Hope you heard. You heard it right. We did talk more about, or we discuss on the public health, or the preventive health. Yeah, we discussed about the preventive health. So you heard more things and a lot. I told you already, or you heard it. Make it a good impact on you. Don't just listen or watch. Leave your comment, share, subscribe. At appropriate time, we will read all your comments. And thanks again to Afrijanga, yeah. Thanks again to Afrijanga for supporting. Yeah. Today we move straight to him at his office or at his environment, yeah. At his environment. Okay. So, still Nana Kwesi TV, education and entertainment. Stay tuned.